I love how you're just like, hello, good evening, everyone. Thanks for joining us. I'm Nicole Nifo here with Perinatal Massage Therapy Education. I'm here with my wonderful business partner, Michelle Francis Smith. How are you doing this evening, Michelle?
I'm wonderful. How are you, Nicole? Good evening, everyone.
I'm well. Yes, thank you. For those of you who are joining us, thank you for those who are watching the replay. We are live every Thursday at 8:30, talking about various topics, all within the realm of perinatal massage and the business of being a perinatal massage therapist as well. And we're excited to talk about something that we don't get to talk about very often, actually, childbirth.
Yes.
As you know, as some of you may know or not know, Michelle and I are both labor doulas. And so this is definitely a part of our practice. And the tips we're going to give today are definitely things that we've used in our own practice. Today we're going to be talking to you about prepping your patients for childbirth, what they need to know to experience their best birth.
Right.
So let's just kind of give people a couple of minutes to just get on and talk a bit about anything exciting that has come up in practice this week. I know I have a story to share, but I wanted to see if you...
Yeah, well, why don't you start with yours? I'm very excited to hear.
So lately I've had a lot of patients being referred from, this one in particular was referred from a friend who is another friend of a patient.
Okay.
So they didn't even know who my patient was. And they were referred because she was going through some breastfeeding difficulties and has had experienced mastitis, which then became a breast abscess, and then had contacted me and was actually in the process of going to get it drained, where they would, the doctor would put a needle in there and drain out the abscess. And then, but still had booked a massage with me. I think it was like 2 weeks out.
Right.
So I finally got to see her yesterday. And she was also a patient who had 2 cesareans. So it was like, some of you know, my cesarean patients are my favorite because that's kind of my focus in my practice is helping people recover from cesareans. And so I got to give her a little bit of information about that as well, like to kind of work in conjunction with the breast treatment. But I said, I don't want to overwhelm you with information. Today, we're going to focus just on your breast. So I had her in sideline and we did a breast treatment and you could feel it. It was like solid rock on the lateral aspect of her breast. And we just did, and I said, do you feel how light my pressure is? I know some of these people are just digging into their breast tissue, thinking that that's going to help relieve the tension that they feel, sort of like people would do to a muscle.
Right.
Forgetting that breast tissue can be somewhat fragile, and especially with the lymphatics there too. And I think she had mentioned something about, oh, the doctor told me just to dig and just massage. And I said, unfortunately, a lot of doctors are not really aware of touch and what kind of touch, although they had good intentions to tell you to touch it, it wasn't in the right way. So I showed her to do her own breast massage. I said, feel what I'm doing. And I worked on her for about like 45 minutes.
Yeah.
Did a little bit of neck, shoulder treatment, but really just like worked my way up, worked in layers, general, superficial, general. And so basically by the end of it, it was like very small, like it was like very soft.
Very soft, yeah.
It was still somewhat there, but a lot softer. And so we were both very happy. And once I started explaining to her about cesarean recovery and working the scar, she's already working out. She's 3 months postpartum. Been dealing with the breast stuff for like the last 3 months and stressed about it.
Right.
And just, she was like, I said, oh, I hope I'm not overwhelming you with information. I'm just so excited that you're here. And she said, no, it feels so good to actually be speaking to somebody who actually knows what they're talking about.
Right.
And right there was just like my fulfillment meter just like went right up. And I just was so excited. And she booked a couple of appointments with me and we have plans that... And she was excited about the cesarean scar work that we're going to be doing. And she was like, can you do both at the same time? I said, yep. So, we're really excited to kind of see how that patient-therapist relationship develops and how I can really help her. And I told her to bring her baby. I said, bring your baby with you. And she's like, oh, I didn't know.
I know that I could. Exactly. So now it's going to really work out because she won't have to worry about leaving baby if that ends up deterring her
And
from
she's in Etobicoke and I'm in Oakville, so she's traveling already like half an
traveling.
hour, right? So
Yeah.
anyway, I had to share that. It was such a great experience this week, and if you have had great clinical experiences this week, please share. Anything this week for you, Michelle?
Well, it's funny that you mentioned this particular client, because I had also someone come in to see me today. It was a week ago that I saw her. I had messaged you, or maybe we spoke at the end of our last live, where I was letting you know I was going to have this woman coming in who's had multiple bouts of mastitis.
Yeah.
First baby, also post cesarean birth, after I think 20 something hours in labor, and then ended up in a cesarean delivery, and had several bouts of mastitis, and had been treated, I think 4 to 6 rounds of antibiotics for the infection. The first one wasn't the right one. There was one that she was allergic to. It like basically has been dealing with breast abscess. She's had 2 of them drained. It drained twice, sorry, by the time she was coming to me. And I was just really excited to see her come back, because we did work last week, and it's very much a bit of trial and error, right? I didn't really know how her body would respond. And the quite large sized hardened tissue has reduced significantly, at least by half.
That's amazing.
And she could see, well, she felt it right at the end of the treatment. She even said, it's definitely softer and smaller right now. I said, awesome. She said it remained that way. She also went to see a chiro who did some ultrasound on the abscess.
Yeah.
She said she had to search and search and search to find someone. People don't want to do it, and they're very reluctant, even if they have training in ultrasound, which I thought was interesting. And it just opened up my mind to a whole other direction too, because I have training in ultrasound, but I always used it for Achilles tendon, different types of injuries, right? Like, not what we would consider delicate tissue.
Yeah.
And I do think that there's more to be learned about how to work with delicate tissue properly.
Yeah.
But that hardening of the tissue, that scarring of the tissue really benefits from the ultrasound. So 3 ultrasound sessions, 1 massage treatment, self-massage, and lots of nursing on that side is showing some great progress. So she's booked again next week, and we'll see how it goes.
That's good. That's awesome.
We have this simultaneous practice going. We didn't even know we were going to share this today.
I know.
So funny.
And something else, I just felt so that she really clicked with her, because just having my experience working with patients who are going through this journey of breastfeeding and having all these difficulties with their own body healing.
Yes.
It's like they're healing from a cesarean, and now they're trying to heal their body with this breastfeeding and feed their child, and don't even have time to heal from their cesarean or birth or however they birth their baby. You just see how much pressure is on them to breastfeed. She's like, I'm pumping. And it's working. It's not giving me mastitis again, but it was almost like she wasn't sure
if she was okay to just be pumping.
Okay, just to pump. And I said, if that's what works for you and you're okay with it, do that. But be confident when you say that you're doing it. Don't think that you're like, well, do it for now. I said, if you need resources to lactation consultants to come, like private sessions, I will send that to you, and you can figure it out there. And if you don't want that and you're okay with just doing it the way you're doing it,
you should just
that's okay too. But be confident in saying it. And even when I was treating her, I was like, let go of any words that people have said to you or things people have said to you onto, right, during this last 3 months, because I've been a mother, like I am a mother myself, and breastfeeding. Although I didn't have any challenges with breastfeeding, I see so much in my patients, and I can see how it would be very challenging and the pressure to do it.
Yes.
And so I can very much relate to them in that way. And so just kind of getting her to like breathe out and just picture releasing those thoughts and intentions that don't help her.
Yes.
So I think she really felt very empowered after. And I think like that's so much of what we can do as massage therapists. And we're doing that with, we're talking about a postpartum patient, but today we're talking about birth and how much we can empower patients during birth or to prepare for birth, because it's such a scary, taboo subject that you look on TV and everyone's like screaming their heads off, or it's like the total opposite, and people are like in the rivers, like, and
Mm-hmm.
it's not always like that. And birth can look like so many different ways for people. And I think that, as massage therapists, we're having these one-on-one conversations with our patients. We can really give them a lot of tips and empower them in their own body through our massage to prepare them for that time where they're going through that journey from being pregnant into, being a postpartum person with this baby now to take care of. So
For sure.
yeah.
Hi, Bhavani, and hi, Roxanne.
Hello, and hello to everyone else watching.
Yes, I see a few more viewers.
We were just sharing our week, just giving you guys time to come on to the conversation. We're just sharing our kind of wins this week and kind of how our practices are really fulfilling us right now. So
Yes.
if you have anything you want to share, even if it's not related to the topic today, please share with us. We love hearing about it. If you have any questions, please comment below. Share this live with your friends on Facebook or on Instagram. And also make sure you sign up to get the reminders every time we're going to go live. I think if you follow us on our Facebook page, the Perinatal Massage Therapy Education Facebook page, if you click follow, you'll be the first kind of to know about or whenever we're posting things. So as soon as I post the topic for the day, you guys will get that. And then on that screen, you'll be able to hit remind so that, because 5-6 hours later, you could be busy and you forget. And you'll get the reminder that we're live. So, but we appreciate you all taking the time to join us. So let's talk a bit about helping our patients experience their best birth. What kind of things a massage therapist can incorporate into their treatments? So we were talking, Michelle and I, when we were brainstorming, we were talking about visualizations that they can take into birth that we give them during treatment. So let's talk a little bit about that.
Sure. Like what I was thinking about when we were talking about that was there's so many moments I'll be massaging someone who's pregnant and they'll get into this like zone of relaxation and almost like peace and balance in their body. And they'll say things like, when I'm feeling really scared during the labor, like I wish I could just return to this moment, or I wish I could feel this when I'm getting nervous just before I deliver the baby, or when my water breaks. And then I say to them, well, why can't you?
Mm-hmm.
You can, actually. I said, so, everything about this moment right now, just break it down inside yourself.
Yeah.
How it sounds in here, how it feels in your body, the pressure I'm using, the sound of the music, all of those things. I said, you can just bottle that and you can pull that back into your mind space when you are delivering, wherever you're going to be, at home, at a birthing center, or in the hospital, wherever you're going to be, and bring that. And I said, and if you have a playlist, so you create music that creates this sort of ambiance. Like you can have lighting, you can dim lights. You don't have to have the full blaring lights on if you're in a hospital. You can create whatever you want. And it's useful to remember that. And many of them have told me that they have as much as they could.
Yep. I definitely always recommend like the lighting and then essential oils. And I just say, if we're in the hospital, just tell them it's scented cream. Yeah, you're doing a little bit of a lie, but you know what? They don't want any scent there. But for me, if it's going to get you through your birth, then, oh, well.
Yeah. Are the hospitals now saying it's a scent-free environment?
Oh, yeah, like when the nurses come in, they're very much like, well, at least the ones that I've been to, and like Mississauga and Oakville, they're like, what's that smell? Like you're not supposed to have any scent here, and it's like, oh, it's just cream. I'm like, oh, okay.
I haven't experienced that yet.
Really? Okay.
No, and I've had essential oils out.
Yeah. I usually like hide them kind of.
I don't know. Yeah. And I haven't actually heard any hospitals come out right and say it. It's
the hospital thing is the nurses, right? When they're coming into the room.
Well, if there's no policy, then
yeah.
I was just gonna say I don't know if that exists. Yeah, interesting.
And also talking about during your massage, like we're talking about how massage is so grounding and how much it empowers our patients during the treatment into their own bodies, all that touch, like you were saying, and just empowering them kind of on like what their body is feeling. Because I think some of what the kind of standard is now is like, half of us want this like totally, drug-free birth and, to be able to feel and experience everything. And then the other half is going like, oh no,
I want to feel it in.
I don't want to feel
Right.
anything, right?
Right.
And I don't think it's about even that. I think it should just be about being in the moment and feeling your body and understanding what your body needs. Because
Mhm.
I've spoken to people who like couldn't even know how to cope, and they had doulas and everything, and didn't even know how to cope with like the contractions they were having at 2 centimeters.
Right.
And whereas there's others that are like, I could have kept going, but my body wouldn't allow me to. And then
Mhm.
there's others you speak to that are just like, I didn't have time for the epidural,
Right.
and I made it
Went
through.
so fast.
Yeah. It's not a pleasurable experience for everybody. Some people it is.
Mm-hmm.
It's not for a pleasurable experience for everybody in the way that it like feels good.
Mm-hmm.
But I do think that it's a necessary thing that happens. Our body does this process of laboring to allow us to have this baby at the end, right? Kind of cool.
Hello.
So definitely, those visualizations are really great. Let's talk about some of the common questions that patients ask. If any of you watching can also comment below, let us know some of the questions that patients commonly ask, maybe during treatment, or maybe they'll email you or whatever it is about birth and how to prepare for it. What do you find some of your common ones are, Mish?
Usually around epidural.
Mm.
So, is it true that if I have an epidural, that I'm going to have more back pain or problems postpartum? That's
Yeah.
usually direct. Or my girlfriend told me that she had an epidural and her lower back has never been the same, which often ends up being a great segue into talking about the actual process your body goes through being pregnant and postpartum, like delivery and postpartum, and that often that lower back pain doesn't have anything to do with an epidural or non-epidural, but like let's look at what's happening to your actual body during pregnancy, your pelvic floor, and what else is going on. So it usually opens up a whole other conversation. That one's a big one. Medications, like options for medication, and if I do the epidural, what will be the impact on my body?
Sometimes there's some fear around the epidural because it's a needle essentially inserted into your spinal cord, right? So it's like, what kind of fears have they kind of accumulated throughout this time while they're preparing for delivery? Or the internet is just full of information. Sometimes they're reading things or on these different forums or groups where they're seeing information that maybe just plants the seed for them, right? And they start stressing about it. So I think it's really a good idea to not have any opinions about what the right way to do anything is. And also, if you are going to be sharing information based off of your experience as a massage therapist or as a doula or as a woman who's gone through childbirth, I think it's important to tell your patient in a way that's not going to, you're not trying to influence them. You're more just trying to be a source of information, right?
Right.
And
Offer
whatever they need. Okay, so we have one from Bhavani. It's not showing up here on my.
Oh, okay. Yeah, I'm not seeing it there either, but you can see it on your computer.
I'm looking at it on the other computer too, so I'm just going to read it.
Perfect.
So Bhavani said, I had a new client this week who is pregnant with her first and a little freaked out about birth. I had asked her if she had any questions and or what she wanted with her birth to be like. She started talking and telling me all about all her fears, etc. Partway through the treatment, she told me she hadn't opened up about her fears to anyone or talked about her birth much at all to anyone, and this treatment and information I provided had made her feel so much better and confident about going into her birth. Yay.
We're both doing the same thing.
Oh, did you doing that? I felt so good being able to help her get to that state. It's those moments that I realized I chose the right field of work. Good for you, Bonnie. Like again, like your meter of fulfillment as a therapist like totally went up when that happened. And just like that's why I took my doula training that I did, because I just wanted to know information, because at the time I had never had children, and even if I did, it's my experience, right? So I just wanted to know like what happens during childbirth and what can the patient be experiencing emotionally leading up to it. And if you're working with a patient who is pregnant or postpartum, it's kind of a good idea to have an understanding of what their body is either preparing for or had already gone through.
That's right.
So, yeah, that's the comment that just showed up.
Now it came up.
Yeah. So that's so great, Bhavani. I'm so happy that you had that experience, and that's exactly what Michelle and I love about our practices and what we try to help, shine to you guys is when you are doing something you love and are passionate and you have the information to be able to share with your patients, and then you get that feedback. It really just makes you feel like you're doing the right thing and that you're in the right field and that you're working with the right patients.
Right. Making the biggest impact.
Exactly.
Right.
So
That's
thanks
awesome.
for sharing. Anyone else has anything to share, please do. What other questions have I gotten about birth? Oh, I've talked to patients about doulas, and the most common misconception is that a doula is a midwife, and they don't understand the difference between the two. And I thought, by now I thought people would have known, but people still don't know. Usually from massage therapists that take our training sometimes, they're like, I don't know the difference.
Yeah.
I don't know what a doula is. So when I tell people like I'm a doula, they're like, oh, delivering babies. And I'm like, no, I don't deliver babies. I coach. It's more of a coaching position. But yeah, it's just a good way to kind of talk to your patients about having labor supports if they don't have a family member that they want in there with them and their partner. Maybe getting a doula, because there usually is a limit to what most hospitals will allow patients to have.
How many people they can have in there.
Unless it's a patient wanting a home birth and they have a midwife, I still think it's a good idea for them to look into getting a doula if they can afford it, because the midwife does need to focus on the medical side of what's going on. And it just allows you to have more of a full team. And I know my husband, when we had our doula for my birth, he felt like he could just kind of sit back a little bit more and not have to be as hands-on as he would have had to be. And it just they would take turns, right? There was moments where I needed him and wanted him close, and there's moments where I'm like, get out of my face.
Where are you? I need my doula.
Stay over there. I need my girl power.
That's right. Yeah. That's awesome.
So yeah, I think it's important to talk to your patients about doula. And so one of the fears is about having a doula is that, they won't have that intimacy or that privacy with their partner. And I think it's important to tell your patients that the doula is not there to kind of wedge in between you and your partner's experience. They're actually there to help support it and uplift it more. I've been to a birth where I was the one sitting back, and I would go in to check and give a little feedback, and then I would sit back again because the husband was just so involved, and that's just their thing they had going on, and I did not want to interrupt that. And they even called me to come back. They just got pregnant again. This was probably 5 years later, but they even called me to come back, and I was like, I don't feel like I did anything. You guys were good. I don't need me. But they still felt like it was a great experience knowing that support was there, right?
Right. All depends on what people need, and we can't assume to know exactly what it looks like.
It's so true.
Let's go back to our list as we are getting close to our time.
Yeah. So how can they use touch during birth to help them cope? So we talked a little bit about
we kind of did.
A little bit about that already. The other one was tips for support person and how you can include them into the massage session. So we can, Sean and we're talking about maybe, giving tips or even a handout or whatever it is that you have, give that information to your patient to tell their partner, to help them through those moments where they need more hands-on or coaching. And then the other option is something I do in my practice is I have a almost like a childbirth prep session. And I either offer it in 1 to 3 sessions, and they're about an hour each. And basically, it's not a childbirth education class. I'm not teaching them about childbirth. I'm showing how that partner, whether it's her mom or her husband, whoever it is, they come to the session, and I show them how to coach and talk to her and help physically support the patient as they're in labor, and just kind of empower that person with my knowledge and experience. And it's been really great because I'm still a part of their birth, but I'm not actually having to go wake up at 2 a.m. and be on call for hours on end to attend the birth. So it's still allowing me to be a part of it.
Absolutely. So I too have done something similar, but even in those sessions where maybe partner's not there, but I'm giving information, leaning on our resources. Like Penny Simpkins has a lot of
Yeah.
documents online, a lot of PDFs that are free. I've
Yep.
downloaded, can't remember what the name of it is offhand. I can look it up and add it later. It's like Comfort During Labor or something. It's like an eight
Oh, yeah.
page, it's
Yeah.
like very simple drawings, and it
Yep.
just shows how a partner, a support person can
Yep.
provide support. And it has different poses with a little brief description. I often will email that link to pregnant
Yep.
clients who want that and just tell them, like you said, look it over with your partner. Then, if there's questions, it's a lot easier for the partner to say, okay, I want to be able to do all of that. And I read it, but I would like some coaching. And
Mm-hmm.
then we can do an actual blended session like that. Or, yeah. But
I know.
it does create more options for us as RMT doulas who
Yes.
might not be able to take on a birth at that time, but want to
Yep.
have create more support for their birth experience.
Yep. And it just helps to create that whole rounded experience for the patient as they're in that perinatal stage, for
Yeah.
you to be able to have some input and give some advice and
Mm-hmm.
for their birth. But there's also, I wanted to mention The Birth Partner, that book.
Yes. Yes.
Yeah, it's a really great book because it talks about, what the patient may be going through as they're laboring and then how the partner may be, what they're going through. So it gives them a really good feel. And it's because it's not just your patient that's laboring and delivering this baby. It's the whole like team. It's their partner that's also experiencing it emotionally.
Mm-hmm.
And so it's important to be able to, kind of know, okay, there may be times where you're feeling this way. So this is how you can kind of get through it. Or if she's kind of seeming like that, then these are some tools you can use during that time. And it just kind of gives like a nice picture of what is actually going on. Lavani said that she offers a similar workshop. So yeah,
Awesome.
I just think it just allows you to have more time with that patient. You're offering them something that maybe is not, massaging hands-on for a whole hour. So it gives your body a little bit of a break, but it's
Mm-hmm.
still within your scope. You're still doing some hands-on with that patient,
Mm-hmm.
some, Remex type stuff. So I think it's just a great thing to add to your practice.
And a pretty easy ad.
It's very easy. Yeah. 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 That was the last point that we wanted to make.
So again, I think something that's key that we were talking about is just figuring out what aspects of your practice really excite you and enliven you and light you up. And then share that with your clients. They won't know that that's an area that really gets you happy and excited unless you're sharing about it. And then they're actually willing and able to access it because you've made it available to them by talking to them about it.
Michelle always says they don't know what they don't know. So with you being able to give that information, it just opens up their world to something that they didn't even know existed.
That's
and again, like what I was talking about earlier, like all of these fears sometimes are like those seeds are planted at a very early age. And it's just in the back of people's minds. Like they don't even realize that they have a fear. Until, like Bhavani was saying, they just start talking about it during their treatment. And they're like, wait a second, like I'm actually not looking forward to this because I don't know if I'm going to have control over anything, or I'm afraid of needles, or I'm afraid of this. And so I think it's great for them to have a nice space to be able to open up and talk about it to someone that they trust as an expert.
That's right.
So,
it's awesome.
Great conversation. Tori says, would those sessions be covered under the client's insurance? Bill it as a massage. So it depends on how you structure it. I think that if you are saying that you're incorporating like Remex and you're doing hands-on with your patient as you're showing her partner stuff, you could be doing the hands-on with the patients. I'm sure you'd be able to cover a portion of it. Right?
Basically, the question is what you're doing in your scope of practice? Right. If it's in your scope of practice, then it's covered under being what a massage therapist does. And if it's what a massage therapist does, then it's covered. Yeah. So it doesn't matter that you're not doing 60 minutes or 55 minutes of hands-on treatment because as Nicole mentioned, Remex is part of being a massage therapist. Treatment planning is a part of being a massage therapist. Assessment and client education is all a part of being a massage therapist. Whether there's someone in the room who's benefiting from your expertise or not, doesn't change the fact that it's still massage therapy. So The only thing is if you're doing something that's not in your scope, then that's not massage. So if let's say you did that for 10 minutes exclusively, whatever the thing was you were doing was just not anything that a massage therapist does, then the other 50 minutes of that session could be covered. But if it is what you do as a massage therapist, in terms of in scope, then you're able to cover it.
Perfect. Yeah, exactly.
That's always the question. Scope, inside or out.
And don't always get stuck on the fact that, like Michelle said, that you have to be doing actual hands-on to their body for it to be massage. Like massage is massage, but you're a massage therapist. This is a massage therapy session. Treatment does not say that it has to just be you and that patient and your hands on their body.
Yeah. Always go back and read that little blurb, right? It's like, what is massage therapy? The assessment and treatment of soft tissue and joints and, injury prevention and client education and remedial exercise. There's a whole list of things. So, yeah.
I think we talk about that a lot in like baby massage too, right? Like when the baby's not wanting touch during that, couple of minutes at the end or maybe even the whole time, and you're using the doll to do the education, and you're teaching REMX really for the parent to be doing with that baby. And like, there's still a way to have what you're doing covered because under a scope. Right. But again, you're like, but my hands are not touching that baby. And it's like, well, you have to go back and read our scope of practice.
Yeah, not in doubt.
It's a great question, Tori.
Yeah, really great question.
But yeah, we always trying to find ways that you can work more with your patient where it's still billable and it's under our scope and that it doesn't take a lot of your physical body to be working to make that that session work. And something like this is something you can incorporate. And if you guys are interested in courses like this, Michelle and I are putting our schedule together for 2019 soon. We want to know kind of what kind of courses you guys are interested in. This is like webinars, even hours. These are online courses, whatever it is. If this is a topic that you're like, I want to be able to offer this sort of thing to my patients, and I don't know how I would do it, and I'm not really interested in becoming a doula. This is something that interests you. Please let us know in the comments or message us, because that's how that type of feedback is how we know what you guys need and what we should be offering you.
Right.
So please comment below. And I think that's about it for tonight, unless there's any more comments come through in the next 1 second. Thank you so much for joining us. A lot of great comments and feedback as usual. And if you are watching a recording of this, please still comment below. We will answer you. And we will see you next Thursday at 8:30.
Next Thursday.
Don't forget to follow us on our Facebook page. There's on the actual front of the Facebook page, it says that you can follow. And on there, you'll get notifications when we're going live and when we're posting. So no problem, Bhavani. Thank you so much for joining us, as usual.
Always great to hear from you, Bhavani.
Yes. Okay, well, I hope you all have a great evening, and we will see you next week. Thanks, Roxanne.
Bye, Roxanne.
Bye, Michelle.
Yeah.